Hi, my name's Holly. Welcome to 5 Minute Birth Classes. Today we're going to talk about when to expect appointments. So I didn't really realise this wasn't something a lot of people knew. I've been a midwife for over a decade, so here in Australia it's just something that I kind of think, oh, you find this out at your first appointment. Apparently that's not the case. So for the first few months, until you're about 28 weeks, you're probably seeing your maternity care professional about every 4 weeks. So, of course, you might see someone a little bit more frequently at the start, especially if you go and get, your pregnancy confirmed, go get your bloods done, get your results checked, get your scan form, that sort of stuff. So you might see someone, say, like, a few times in the first trimester, maybe 2 or 3 times before you're 12 weeks. And then usually every 4 weeks is pretty common. So from about like 12 weeks, then 16 to 17, 20 to 21 weeks, about 24 weeks, 28 weeks. And then it kind of depends on your pregnancy and your care provider, but then it goes to about every 2 weeks. So you either start the 2 weeks from 28 or from 32. So again, very much dependent on your care provider. But where I'm used to working is from 28 weeks, you go 30 weeks, 32, 34, 36. And then you can go every week from then. So 36, 37, 38, 39, 40 weeks. Or you can kind of go 36 to 38 weeks and then every week till you have a baby. The normal length of pregnancy is anywhere between 37 to 42 weeks. So it's really kind of nice to have a lot of appointments, especially towards the lead up to your due date. Of course, your due date is not a guarantee. Only about 2% of people actually have their baby on their due date, so it's actually really uncommon. But generally speaking, you have about a dozen appointments over your pregnancy if everything's normal. If there is a medical reason, if you have a family history or a medical history of something, if something develops in your pregnancy that ends up meaning that there's a need to kind of closely observe things a little bit more, then obviously you're going to get more. Say, for example, you have like a twin pregnancy, you'll probably have 4 weekly appointments until 20 weeks, and then it might be like every 2 to 4 weeks, kind of depending how growth is going. You might see a doctor more than a midwife, or just alternate doctor midwife appointments. For the majority of the places I've worked, which is mostly in the public sector here in WA, the midwives will do most of your care, and then you'll see a doctor like a couple of times in your pregnancy. So currently where I work, they see a doctor will see you at in your first trimester, so usually like kind of 10-ish weeks, and then again at about 30 weeks, and then again at about 38 weeks. And then the midwives do all the other appointments. Some private obstetricians will see you every single appointment. You might see a midwife first, so they do your blood pressure, your weight, all that sort of stuff, and then you just see the doctor. For working in like a hospital clinic, it'll be the midwife for most of your appointments and maybe a doctor at like 34 to 36 weeks, and then again at 41 weeks if you're still pregnant. So difficult to say exactly what to expect, but about every 4 weeks until 28 weeks, every 2 weeks until 36 weeks, and then every week until you have a baby. Exciting!